Peg Bolgioni, Communications Specialist with Rutland Regional Medical Center, and I'd like to welcome you to Window on Wellness. We are pleased to have Dr. Matt Gammons, sports medicine physician with Vermont Orthopaedic Clinic, joining us to discuss concussions in sports, separating fact from fiction. I will be back with Dr. Gammons after this message from Rutland Regional Medical Center.
Back in 1896, the Rutland Regional Medical Center was created to meet the needs of our community. We have clinics, we have emergency departments, we have operating rooms, we have inpatient beds. We take care of patients with heart disease, with cancer, with drug rehabilitation needs. Everything that our community needs and demands. We're so proud to take care of our community, and we always make this promise. We listen, we respect, we care, always.
Welcome back to our program. I'm very pleased to have as my guest today Dr. Matt Gammons, who is a sports medicine physician with Vermont Orthopaedic Clinic. And Dr. Gammons, thank you for joining us.
Yeah, thank you for having me.
And so we're here today to discuss concussions in sports and hear the facts from you about symptoms and treatments and how to be safe on the field. So I think we probably want to get started. So why don't you just identify what is a concussion?
Well, that's probably the million-dollar question. What really is a concussion? And I think we're learning more and more as we go forward. We basically define a concussion now as a traumatic injury to the brain that creates some small amount of damage, but not the kind of damage that really shows up on tests and images, but can create disturbance within the brain in terms of how the brain processes. The problem is that it's very confusing when you don't have something that you can measure directly. And so some kids, it's very easy to say that the brain was involved, like they got knocked out. Other kids, it's much more difficult to get a sense of whether or not the brain was truly the problem or something else was the issue.
And so somebody gets a concussion and they come into the ED or they come into your office. And so what is the diagnosis process that they have to go through?
So yes, diagnosing concussion is very complex in most cases. And I think what we've done is good in that we've basically made athletes and parents and coaches really aware of what the potential symptoms of a concussion are. Because it's really important if an athlete sustains concussion or anybody sustains concussion that they sort of pull themselves out of any at-risk activities. The problem is then we have to try to do some detective work to figure out whether or not we really think that they had a concussion or not. When we see, most of the athletes that I see will either be initially on the sideline of the game and then occasionally in the office, and then some athletes will end up in the emergency room. Our first job when someone has a head injury is to really make sure they don't have something more than a concussion. So we're looking for signs and symptoms of bleeding, swelling, things that could be life-threatening. Since fortunately most athletes don't have those, we then go on to the next step of trying to determine whether or not they've had a concussion. Most of the symptoms of concussion are not specific, meaning you feel a little foggy, you might have a little bit of eye disturbances, you feel nauseous, all these sort of things that can be caused potentially by concussion, but could also be caused by injuries like whiplash. Some kids can get post-traumatic migraines and things that act this way. And so we go through a battery of tests that give us some information about how things are processing, but none of it's very specific. So many times we're down to the conclusion of, hey, listen, you had a head injury, you have some symptoms that may be consistent with concussion. We need to just kind of take you out of harm's way, observe you, and see how things play out. And sometimes down the road, we can figure out whether or not we really think there was a concussive injury or not.
So is it, would a determining factor be an MRI or a CAT scan? Would that tell you more?
No, unfortunately not. A CAT scan or an MRI can be used to look for more serious injury like bleeding or swelling, generally CAT scan, but they should only be obtained if we're really worried about those particular injuries. There are lots of experimental studies that have looked at versions of CAT scans and MRIs to see if we can detect any disturbances that may help us. But the problem is you're taking an imperfect diagnosis and then you're trying to study something of an imperfect diagnosis, so it makes it very hard to know what those studies are really showing us. So in the end, it really is using some experience and some understanding that we need to be cautious with these injuries, and we're better off getting an athlete out of harm's way in the short term, even if we're not 100% sure they had a concussion.
Do you have, I know when you're trying to kind of triage the problem and you're trying to figure out, is it a concussion or is it something more serious, trying to rely on information from the patient, can that be a little challenging, I mean, given the state that they're in?
It can be very challenging, and that's one of the problems. The symptoms they report are probably the most valuable thing that we have. On the other hand, some kids can't report symptoms very well.
Right.
Sometimes that may be intentional, although I don't think it's intentional much anymore. I think it's more that if the brain truly has been injured, they don't feel well. And so sometimes it's hard for them to communicate those things, particularly younger kids. There are sets of tools. There's something called the Sideline Concussion Assessment Tool, which has a checklist of symptoms and other tests that you can go through that, again, may give us some information as to whether or not a concussion has occurred, but we don't have a single diagnostic test that we can use as a standalone to say, hey, this athlete clearly had a concussion, other than if they have the 3 cardinal symptoms, which are they lost consciousness, which isn't very common. It's only about 10% of the time.
Right.
They have true amnesia, meaning they can't remember periods of time, or they have true confusion, like the kid that goes to the wrong bench. Now, the amnesia and confusion often go together. That's part of it. But beyond those 3 symptoms, everything else, again, could be from a head injury, may not be from a head injury. So we always want to be cautious. So if we can't be sure that it's coming from something else, we're going to hold that athlete out until we can get more time and more information.
Right. Once it's evaluated and you are fairly certain that it is a concussion or some type of head injury, how do you go about the treatment piece of it?
So once we're sure, again, on the sideline, once we're sure the athlete is safe and we got them out of harm's way, basically it's relative rest. I mean, that's really what the brain needs if it's been injured. It doesn't need complete rest. In most cases. In some cases, it may need some rest for a few days. We've gone through this period where we didn't think we needed to do much for concussions, and then we said maybe we need to lock you in a closed room in the dark for a while. But it turns out really for each individual kid that as much as they can reasonably do is actually probably better than doing nothing. So light activity, as long as it's not worsening symptoms, light schoolwork, even, we talk about avoiding screens and other things, and certainly if those are aggravating symptoms, we want to stop that, but there's no one thing that an athlete shouldn't do. So the biggest thing is educating them about the need for rest and staying out of harm's way if they have symptoms, and then just making sure that we're giving them time. Now, once they feel back to normal, and normal's all relative, particularly for high school kids, right? Teenagers can be a little abnormal to begin with. But once they're back to sort of their normal, then we want to go through a progressive return to learn and a progressive return to play, where they just kind of increase their activity as tolerated over a number of days.
Well, so what's the timeline, I guess, when the person, from the time of injury to the time of recuperation to the time that they may be able to return to play? So,
I mean, if you look at averages for young kids, so less than 12, maybe along 3 weeks. High school kids is probably closer to 2 weeks. Adults, college kids, maybe 7 to 10 days. But those are averages. So in the end, it really, return to learn can be almost as soon as the person feels comfortable. Some kids can return the next day and not have any problem with academics. The return to activity is generally we take them through a progressive stage where we go from light activity to intense activity without contact and then increased contact. That's usually done over 5 to 7 days based on the age. Just ensuring that they're tolerating all that loading that we put on them. We're not making their symptoms worse. And some of that also just helps us hedge our bet, to be perfectly honest with you, because we don't completely understand when somebody's recovered. We have to go by how they feel. We know that exercise can sometimes bring out those symptoms, and so if we bring them a little bit along a little bit slower, that just gives us a little bit of a leeway in there. So if a student is back in school, after they've gotten out of the hospital or come home, and they go back and they start having symptoms, I mean, is there any other monitoring that goes on in terms of their injuries? So it certainly depends on who's seen them, but usually someone at each school will have either a school nurse or an athletic trainer. Somebody will have some sense of what's going on. Again, if they develop symptoms at school, it doesn't mean they have to be out of school completely. It depends on how much they're tolerating. So some kids can go to a couple of classes, then they need a break for a little bit, and then they go back to a few classes. Every kid's kind of different. We certainly like them to be able to tolerate a little bit, just so they're not wasting people's time and their time going for 30 minutes. I think the biggest mistake is saying that, if I'm having symptoms, I'm really causing problems. And the answer is no, but there's some common sense into, I'm not going to push through my symptoms, but it's okay to push up to my symptoms. Now, when it comes to exercise-related things, one of the confusions is we use exercise for treatment of concussion. It's one of the things that we actually have that probably helps the brain recover. Particularly once you get outside of about 10 to 14 days from the injury, we know that acute brain sort of issue is starting to resolve, that even if a kid is symptomatic, we may have them exercising. So we're not trying to rush them back to return to sport, but we're using that as a tool to help their recovery. And
I guess, you know, we talked about prevention and concussions, and I mean, there's no silver bullet, or is there?
No, it'd be nice if there was. One of the problems with sports injuries in general, but particularly concussion, is that its exposure is the biggest risk factor. So being out on the field, playing sports, doing activities, and that exposure is so much more powerful in terms of risk of injury than anything we can do prevention-wise, that even stuff that works in injury prevention, it's marginal because this is so great. So where we do have some opportunities are what's already been done, which is behavior and rule changes. So they, you know, even at the professional level, we've changed, you know, hitting unprotected players. We've changed the way that people tackle. At the younger ages, we've changed how they learn how to tackle, how soon they start tackling. In hockey, they change when they can start hitting. So these changes clearly have made some difference because it changes exposure. Protective equipment is the thing that probably is most confusing in this picture. And unfortunately, helmets don't do a good job of protecting us from concussion. And if you think about what a crash test dummy looks like in a car, if the car is the helmet, it does a great job of absorbing all that energy to help protect us from breaking bones and things. But what does the crash test dummy do? He still flails around inside the car, even with a seatbelt on. And so if you think about the brain that way, when we get hit, even though the helmet does a great job of protecting us from the impact, it doesn't really stop those forces from moving the brain back and forth inside. And it doesn't necessarily have to move a lot. So we're not looking at better helmets as a solution to this. In some ways, I would argue that some of these tools that people have used and add on to helmets actually make it potentially more dangerous, because if the kid doesn't feel it as much, they're more likely to hit with their head than if they feel it a little bit. But in the end, you know, most modern helmets do a great job of protecting you from breaking your skull. They do seem to protect us from more significant injuries like bleeding and swelling. But nothing that we know of seems to do a good job of concussion because it's not controlling those forces well.
Yeah, because I'm also thinking about the neck rolls, or, you know, my brother used to play football many years ago, and I remember he would have that neck roll to kind of stabilize his neck. But, and is it all interrelated, or? Well,
that's a great question. So some people have linked weaker neck muscles to risk of concussion, but the confusing thing is whiplash. So that sort of cervical strain that people get can present with fogginess, headache, light sensitivity, nausea, dizziness, all the same things a concussion can present with. So the question becomes, are people with weak necks more susceptible to concussion, or are they more susceptible to whiplash type injuries, which then get mistaken for concussion? We do know that muscles' ability to absorb energy is helpful, so that if I'm prepared for a hit and my muscles are tense, I'm much likely to have a problem than if I'm unprepared, which is why they changed the legislation at the NFL for sort of the unprotected wide receivers and people out, because when they were, again, unprepared for that hit, they were much more likely to get hurt. So there may be something to the muscles being able to absorb energy. The problem is, if I'm not ready for something, it doesn't matter how strong the muscles are. Because the muscles aren't ready, they're not able to absorb that. My personal feeling is that in most cases, the neck issue is really more of a cervical strain. I'm going to injure my neck, which will then mimic signs of concussion, than neck strength likely helping us prevent concussion.
Okay. And so, I mean, they have a concussion, they get injured. How is this going to impact a person's future in sports?
Well, for most athletes, fortunately, it's not going to impact them that much. I think we know that most young athletes who suffer a concussive injury, as long as we get them out of harm's way and let them recover, they're going to be fine. They're going to be able to go back. And that's true even if they have several concussions over probably a period of a high school or a middle school. There are some concerns, obviously, about the long-term consequences of sort of repetitive head injuries, and whether or not that's actually the concussive injury itself or this sort of repetitive blows that aren't, people define them as subconcussive, but meaning forces that are being applied to the head that don't create concussive symptoms but may over time create a problem. We don't really understand these forces completely and what they mean to the average kid. But we know that, you know, most kids who play middle school sports don't play high school sports. Most kids that play high school sports don't play college sports, and most kids that don't play college sports don't play professional sports. So there's a little bit of a natural selection that only a small population is ever going to be exposed over time. We also know from big population studies that kids and people that have played high school football and college football do not seem to have a higher risk of long-term degenerative brain problems and other things. A lot of information, even in the NFL players, shows that they're less likely to be depressed and less likely to have suicide than commit suicide than the general population, not more likely. So what is likely is that for individual athletes that sustain these injuries, a combination of their genetics, how they're built, how many head injuries they've had, what other factors, including medications, other drugs and things they may have used, that the repetitive blows may play a small part in what happens to them in the long term. But for most people, it probably doesn't play a big part. Somehow I managed to get through med school having had 7 concussions before I got there. Fortunately, I recovered well from all of them.
That's
I don't
good.
know what that's going to mean down the road for me, but honestly, I'm not too worried about it. Now, there are individual kids that will have problems, and so I think that's why it's very important to understand that all these injuries need to be treated individually, because they really are individual injuries.
Well, and I think I was reading or listening somewhere about the younger students that get involved in sports, the more dangerous it is. I mean, in terms of the brain development, and maybe you can speak to that.
Well, there's 2 issues. There was a recent study that was just published out of Boston University that just said if you start playing contact football before 12 and after 12, the rates of behavioral stuff.
Right.
The answer is it's a little concerning, but that's really an association, not a causation, meaning that if you look at the weaknesses of the study, like many of these, they're basically asking people later on what's going on with them and then going back and saying, when did they start? That's not really a great way to prove things. And I will tell you, in medicine, most of the time when we go that way, what we thought was going on turns out not to be the right case. Now, that doesn't mean that it's not something we should look at closer. If you look at just sports in general, no, sports are good for kids, but sports specialization, meaning playing the same sport or playing sports too much too soon, so the magic number seems to be about 16 hours a week, does seem to increase your risk of injury overall. I think when we look at, down the road, all these things are probably going to change as they evolve. And I think, again, I think for most individuals, particularly the way that youth football practices have been modified, delaying some of the contact the way that they have, and just having a better understanding that, hey, we need to get kids out of harm's way when things go on, is likely to head off 99% of these issues for most people.
So what do you think? I mean, you're a parent, and what are important takeaways for parents, on concussions, or just, help, advising their children, how to avoid injuries?
Sure. So this is always a balance. So when I trained, we were always trying to basically scare and panic people about concussion because people weren't listening. We felt like people weren't listening to us.
Right.
And then I think we got to the point where I spend more time now trying to calm parents down about the injury than I do. So I think the balance for parents is to understand that these injuries happen, and yes, if we're smart, we can minimize the exposure risk to these injuries, but in the end, we see lots of kids that aren't even playing sports that have concussions because they slip and fall, and that, when we see these injuries, it's important to recognize them. It's important to see somebody who has some experience in dealing with these head injuries, but it's also important not to panic. It's important to understand that most of the time they're going to do fine, and that even ones that have trouble for a little bit longer, there are treatments available that we can use to try to help them, not only in the short term, manage better in school and other things, but also help them long term. And that, if we do that, again, I think almost everybody's going to be okay. Yeah.
Well, and I know, and of course there's been so much in the news about concussions and then the thing with Aaron Hernandez, and I mean, I don't know if you can speak to that. I can't remember the name of the condition.
Sure. So so Aaron Hernandez, what they talked about his brain having is something called CTE, which stands for chronic traumatic encephalopathy. The problem with this sort of disease is that it's really at this point somewhat of a theoretical disease. What they're looking at is in brains of former athletes, they're finding these protein deposits. The problem is those protein deposits aren't correlating well with symptoms. So you have athletes that have lots of symptoms and no protein deposits, and you have athletes with protein deposits and no symptoms. And so we don't really know what to make of that information. So to say that that's exactly what's going on is really hard. And someone like Aaron Hernandez, if you look at behavioral stuff, there was a lot of behavioral stuff going back to even high school with him in terms of some of the gang things and other things. And so did head injuries contribute over a career to possibly some of what went on with him? The answer is nobody really has the answer, but maybe, but probably more of a small percent than a big percent, and that's true for probably most individuals. Most individuals that play in, like I said, in the NFL aren't having these problems and symptoms. We don't yet have big studies looking at most of these athletes without symptoms. So the brains that Boston University has looked at are donated by families that were concerned these people had symptoms, and so what we need is a bunch of athletes that didn't have symptoms, and then to be able to look at their brains so we can compare how much is this just a marker of trauma but not a marker of having neurocognitive problems, and because those two different things, or is it some direct cause? And we have to try to sort through all this. It's a scary thing because there have been cases, and there was a case report of a former NHL fighter who was having some issues, who killed himself thinking he had CTE, and it turns out he didn't. He probably had treatable depression. And so, we have to be very, very cautious to sort of look at some of these athletes and attribute everything to the fact that they had head trauma. We don't want to ignore that, but we also don't want to miss treatable causes that people have gotten that aren't associated with that.
Right, right. I mean, do you feel that, with all of this negative publicity that's out there, do you think that that's going to diminish young people participating in sports because of all this hype?
I don't think in general it will. I mean, there's certainly, I think, if you look at football, there's been some decline, I think, in some areas. Other areas, there's been no decline. But that's true. Even sports like baseball, where you don't see a lot of concussion stuff, there's been some declines in youth sports. And so I think what we know is that overall, sports is great. And sports is great for kids, and it's great for development. And that, yes, injuries is part of sports. Unfortunately, we're never going to prevent all of them. But the benefits that people gain from sports are way greater than the risks, as long as we use common sense and do the things we talked about. I think the pendulum will tend to swing, which is what happens with everything, is that we get to a point now where we have this cusp of information and everybody's really worried about it. As things go forward, it will probably settle out and it'll probably refine itself, and we'll find some ground where we say, well, maybe this little group's at risk, but most people aren't. And then I think you'll probably see sort of people relax a little bit. I have two girls, not that they're going to play football, but I would let them play football. I mean, if that's what they like, I wouldn't push them to play football. But if that's something they really like to do, I would let them play. I wouldn't have concern about my son, playing football. I think the benefits are just well beyond any potential risks.
All right. Well, Dr. Gammons, thank you for sharing this very valuable information. And now we're going to hear from Matt Howland, who is the athletic trainer from Vermont Orthopaedic Clinic. He is actually on site at Alumni Field.
So in Vermont, there's a state law that says for every collision sport, and collisions defined as football, lacrosse, ice hockey, and wrestling, that on the sidelines of competitions, there has to be somebody who's trained in the management of concussions. Whether that be an athletic trainer, a physician assistant, I think even an EMT can qualify as that. So in Vermont, in the state of Vermont, in collision sports, there's always somebody on the sidelines of that knows how to recognize and manage concussions. And every concussion's different, and everybody who recovers is different. So some athletes who sustain concussions can really kind of progress through in a matter of a few days to be fully recovered, while other athletes can struggle on for a couple of weeks to even a month or more. So it's very individualized, and there's no one right or wrong answer. There's no set number of concussions where you start thinking about limiting them from playing contact sports or even sports in general. There are red flags that we look for. So if you have gotten 5 or 6 concussions, but all of your concussions have healed in the same time frame and there's no red flags, you can continue playing that sport. However, if you get 1 concussion and it takes you a week to recover, and then you get a second concussion and it takes you 4 weeks to recover, and a third week you get a third concussion, takes 3 months to recover fully, well, that's a red flag that maybe we should start thinking about, modifying your activity, maybe talking about changing a different sport or a different position. So in those cases, that would be the time to start having a discussion about looking at, well, why are you an outlier of how somebody normally responds to concussions? There's no helmet that prevents concussion. There's no magic headband that prevents concussion. Those headbands that people see for soccer, that I see people wearing all the time, they wear them to prevent concussion, but really what they're preventing is they're preventing facial lacerations. They're reducing the risk for skull fractures if somebody goes head to head with them. The same thing with football helmets. There's no football helmet that's designed to prevent concussions. They're there to prevent skull fractures. And any company who markets their product as it prevents or reduces the risk for concussions really being disingenuous. So the biggest change is kind of this NFL heads-up concussion program, where it requires all coaches to go through the heads-up training. And it really does a great job of teaching kids proper tackling technique, teaching kids proper blocking technique, really teaching kids how to keep their head out of the game and reduce the risk of head injury as much as possible. And I think that's been the single biggest safety modification that's been made in the last 5 or 10 years, for sure. And there's a lot of concerns with kids playing football and playing hockey because of all the news of all the NFL players that have problems later in life. And well, it's true that there's several NFL players that are really struggling with head injuries. I tell parents all the time is that most kids who play high school football aren't going to go on to play college football, and most kids that go on to play college football aren't going to go on to play in the pros. As you age, your exposure drops, because you're not going to play as much football. You're going to drop out. So for a normal parent whose son wants to play football at the high school level, who's got no intention of going on to play college or pro football, it's fine. Your risk is very, very low. Especially if there's no red flags. If it's just a number of concussions that we're talking about, I kind of go and take a look at their technique. And I want to see if there's a problem there. Are they tackling well? Are they using proper technique? Are they playing under control? And a lot of times in situations like that, because I've come across that where you have a kid who's got 3 or 4 head injuries and the coach is saying, oh, what's going on with this guy? You look at practice and you look at how he's tackling, or you watch the game film and you see that he's not using proper technique, that he's throwing himself in there head first. And a lot of times you can kind of make that change and talk to the parent, talk to the kid, talk to the coach, and say, listen, you have to change the way you're playing. You know, you throwing yourself head first at somebody's knees, that's why you're getting injured. So we need to change that to reduce the risk. Know your athletes. Concussions are usually very easy to spot. And sometimes you don't spot them the moment they happen, but you can definitely spot them 2 or 3 plays later. What's really hard is when you're trying to evaluate a concussion on an athlete that's not one of your own. So if it's a football game and the visiting team doesn't travel with an athletic trainer, and then one of their kids gets hit and you're called to evaluate them, sometimes it can be tricky because you don't know them. You don't know the ins and outs. But if it's an athlete that you're familiar with and you're doing a concussion evaluation, you know, 99% of the time, you know right off the bat, talking to them, that something's not right. And then you can see it on the game film, on the game field, when they walk up and they kind of shake their head a little bit and they sway and they wobble and maybe start walking the wrong direction, or they just start acting a way that's not normally them. All of the new emphasis on concussions has definitely made people aware that concussions are no longer something to just say, oh, he just got his bell rung and he's fine. So, you know, it's good that we're aware that these are serious injuries to be dealt with seriously at the time, and to have that protocol and the progression to get them safely back as quickly as we can, but as safe as we can, is great. But the other side of that is now every time somebody hits their head, it's always, oh, are they concussed? Are they concussed? And at the clinic, there have been multiple times when we've seen a 7th grader or an 8th grader come in and they've been diagnosed by somebody having 6 or 7 concussions. And you go back and you talk to them and maybe they've had 1, maybe they haven't had any. But just because the awareness is there that every time they get hit and they have a headache, they get diagnosed with a concussion. So the backside of that is, I think sometimes that we err on the side of caution for sure, but sometimes labeling some of those as concussions 3 or 4 times with the same athlete can have a detrimental effect as well.
Thanks for joining us here today. Please continue to watch Rutland Regional Medical Center's Window on Wellness, which airs weekly on PEG TV, Channel 15.
This is Shane, my therapy dog. I really enjoy bringing him to Rutland Regional Medical Center because I can just see what it does for the patients. I think we make a lot of people happy and relaxed when we come. It takes them out of really where they are. People I don't even know will say hi to Shane because they've seen him at the hospital. It's like, look, there's Shane. Hi, Shane.